And we have been asked by many of my patients to do a live session on asthma. And recently we had International Asthma Day. So I thought it would be very appropriate to create a live session where we go over most of the common questions, how we diagnose, treat asthma, treatment, and what are the latest research. And especially, I had a lot of questions regarding occupational asthma. So I will go over all these questions and hopefully that will answer most of your questions. First is, what is asthma? Before we understand asthma, we need to understand our respiratory tract. This is trachea that gets divided into two branches that we call the main branches, and they go to each lung, and then they keep on dividing further into like a bunch of grapes. The lung is, analogy wise, is packed like a grape. Those stalks are the bronchi, and the place where this grape is attached is like alveoli or the functioning unit of the lung. That's where exchange of the gases happen. So see the nature in a very small area in each lung. It is estimated it packs about surface area about of a room of 10 by 10. So it's pretty extensive area, and till we do a lot of damage to it, most of the time nothing bad happens to our lungs. But in asthma, it's primarily a disease of the last bronchioles, and that tubes are made up of they don't have a cartilage the way we have a cartilage here. It's a smooth muscle. There's a muscle layer. Inside is the layer which where all the mucus is created, that we call mucous membrane. So inside is mucous membrane, then the muscle, and then there's a third layer. In asthma, the problem is your muscle goes into spasm. That's why if it's like a tube which goes into smaller in lumen, so that's the one problem you have. Second is the innermost lining of your mucous and lining of your bronchioles, that there is a inflammation. So there are two components, the spasm component and also there is a component of inflammation. So what is the end result? The tubes become narrow and the inner lining produces a lot of mucus. So they it's narrow already and then the mucus gets stuck. So there are two pathological problems, the spasm of the smooth muscles and decreases the alpha inflammation. This is not a new concept. We knew this concept for ages that this is happening, but the treatment is evolving and the guidelines are evolving, and then the long term studies which are coming, they are evolving. Symptoms are very classic. People always complain of wheezing, difficulty in breathing, and then you have a very sticky feeling that you want to cough out something and nothing is coming out. And you are feeling weak and tired, and cough can sometimes be very exhausting, and it can limit your lifestyle, it can limit your life in general. The way we categorize asthma is based on the severity, like how in asthma treatment and the assessing the severity, there are two components to it. How frequently you have the symptom and what are the other things which are happening in the body. Severity is if you are having asthma less than two times a week, occasionally, and it doesn't bother you much, then we call intermittent asthma. If that asthma happening more than 2 days a week, and that is called mild disease. If it's 3 to 4 times a week associated with other symptom, that's a moderate disease. And if it's all the time, it's limiting you from performing the activities which makes us human and live, that is a severe disease. This is a simplified version to less than twice a week, 2 days a week to all the time between intermittent, mild, moderate, and severe. This categorization is very important, and also how much it affects you. If it is affecting you to the point that you cannot function, you cannot work, that adds to the severity, and your severity can be adjusted up and down. The way we diagnose asthma is technically no test is needed. It's a clinical diagnosis with your history and examination. But there are a couple of tests which we could do. One are that if we do a chest X-ray, which is the most common lung test which gets done, because your lungs are in spasm, so the bronchi, your alveoli or the exchange places, they cannot empty out. Your lung will be trapping a lot of air. That if you take the X-rays, it looks lot more darker than normal X-ray. Number two, because of the air it's trapped, it pushes the diaphragm down. So those are the minor thing. But the physiological test is, we call it spirometry. Spirometry is a test where in a machine, you after you initial tries, you take a deep breath and then you exhale as much you can in the machine, and the machine is recording how much breath you took in and how long it took to exhale everything out, and in the first minute how much you exhale. Also, what we do is in that test we give you a medication which you call beta 2 agonist, or a medication which we normally use albuterol, that medication. Once you give that medication, and in asthma it's a reversible problem, that spasm and the inflammation, spasm at least is reversible. So when we give the medication, we expect your obstruction to improve, and there should be improvement in the all the parameters. And that's how we do the spirometry. You breathe, we record, and then we give the medication, and we you do the same process again. In this, we are testing that how much your lung function improve. If it improves with this treatment to this thing, that confirms the reversibility nature, and that is goes along with the asthma. There is a one simple test which called peak flow. You could get it from the pharmacy, and peak flow is I think is the better test in my way. You could carry all the time. You could have your baseline peak flow, and then when you blow through that, it will tell you how much you can, the maximum effort, and you cannot. If you do that, you could normally day to day you peak flow. You could check your asthma. Severity on day-to-day basis. So these three texts, spirometry, chest X-ray, clinical, this is how we diagnose it. Usually the triggers are very simple. Most of the time it's allergic. It could be environmental. It could be weather. It could be sensitivity to heat, cold, infections. All these things come into play. That is very important that you kind of identify your own trigger, whether it's where you're living, because if you avoid those triggers, you avoid technically the asthma flare up. And that's one of the things which we seen patients don't pay much attention. They keep on getting themselves exposed to these triggers, and then repeated flare outs, repeated emergency room visit, doctor visit. It's a very cumbersome disease because asthma kind of affects the patient, it affects the child, it affects the old people, it affects life. Your life gets restricted. It's a very dynamic and very this thing is. Just regard your airways like tubes or tunnel, and whenever the is your lungs are in spasm and the inflammation, there is a blockage, and you feel those symptoms. Metaphorically, this is a very tough disease. Now, the Other common question which we always ask is that like the patient have most of the asthmatics now the pulse ox and peak flow they have at home. Their peak flow will change, but the oxygen saturation doesn't change, and they tend to ignore it. In case of asthma, I'm not talking about COPD. In case of asthma, your saturation, oxygen saturation will not go down till you are very late in the game. So don't go in asthma, people. If your doctor has told you you have asthma, don't go by saturation because saturation is not a good test to tell you about the severity. If you're asthmatic and your saturation is down, you're in a pickle. You better run to the emergency room. So by that time, you will be very weak and tired. Chances are you will be in the hospital, but don't ignore that part. The saturation part of it is. So other, what are the other things you could do to help yourself? Vaccinations. I know there is a lot of science, pseudoscience, with now Robert Kennedy taking over. There is a lot of concern about the vaccines and all those parts. I'm glad everything will be retested, but vaccines have a long history of protecting us, saving lives, protecting you going to the hospitalization. Depending on your age group, most of the asthma flare ups are viral infections. Those viral infections are the one, whether it's COVID, RSV, flu, we have the vaccines available to protect you from that. If you are diagnosed with asthma, talk to your doctor and get appropriate vaccination. And you have to follow the vaccination schedules as prescribed. Also, all the pain and suffering with asthma lies, and if you, God forbid, you get pneumonia, you want to make sure you get the pneumonia shot. So every patient who has asthma should consider based on their age for vaccine, pneumonia shot, flu shot, RSV shot, and COVID shot. Treatment. It used to be, remember, we talked about four categories: intermittent, mild, moderate, and severe based on duration and severity. Now we know for a fact it used to be like the initial stage, we used to give just inhaler, which releases the spasm on the those bronchial tubules, and you feel better. That is proven to be not correct because there are two parts to it: inflammation and the inner lining and the spasm both are happening at the same time. So the current guidelines are that we have a GINA criteria. It's a global initiative of asthma treatment. What they do, they are recommending is that everybody should be on medication to decrease the inflammation and the spasm. And those are there are different classes of medications. The medication which release the spasm, they are we call beta 2 agonists. They come under common name Ventolin, Preventil, those medications. We used to give you just take it as needed. That is not proven to be right. Now they are recommending that you should be on inflammation reducing. That is the medication which is inhaled corticosteroids. They come under four different kind of fluticasone. The steroids are fluticasone, medicine, baclovent, and betamethasone. All these things are combined with beta 2 agonists. They come in the common combination, which you might have heard the name Symbicort, Brio, all those one you need to use, and Advair you need to use those instead of one just for the spasm. Then if your symptoms continue to get worse and you're long-standing asthmatic, I want to bring in a concept of chronic obstructive pulmonary disease. By the time I'm a primary care physician, basically deal with adult patients, even the asthmatics who have been asthmatic for 15, 20 years. Remember, we talked about when we do this spirometry, we give the medication, there is some reversibility, but after that, there is that your function should improve. But what we found it is as we go along, your spasm, your obstruction becomes fixed. That is the time you could be named as COPD. And these are the names which are used usually in general practice. People think that COPD means smoker and the emphysema. That is not true. COPD combines is a generic name for chronic bronchitis as emphysema and obstruction, which is developing from the long-standing chronic asthma. Uh, what are the other things which can present like asthma? Obesity alone can give you short of breath and heavy wheezing. Obesity give you gastrointestinal reflux that can also present as symptoms similar to that. Allergies, environmental allergies can present the same way. And then if you have scarring in your lungs due to occupational exposure or your work or home, that can present the same way the asthma is. What are the ways you could help yourself? The first, which I said, was preventing the triggers. Number two, we talked about the vaccines. Third, let's talk about diet. There are diets which give you inflammation. Remember, we talked about there are two parts in asthma: spasm of the bronchial muscles and also increase inflammation. What are the diets which give you inflammation? Is anything processed, whether it's a processed carbohydrate, processed meat, or processed fat. If you are living on a typical American diet, you will be at high risk to develop frequent flare ups because this pro inflammatory foods with simple carbohydrates, soda, Gatorade, all of these simple juices, sweet tea, cakes, cookies, candies, pasta, all of them, they are pro-inflammatory and they are shown to increase the inflammation, and the inflammation can lead to frequent flare-ups. Now, what are the foods which prevent inflammation? Avoid these medications. That's avoid these foods. That's number one. Second is go with the food which took away the inflammation. Those are commonly tested as omega-3 fatty acids, which are coming from fatty fish like salmon, flaxseed, green vegetables, legumes, ginger, turmeric, garlic, all of them which we should be consuming on regular basis, they decrease inflammation. They have found it out is that if your body mass index is more than 25, your flare ups are more. So, being overweight with asthma is an independent risk factor or contributes to your frequent flare ups. So, the diet wise, you could do a lot because it's a long hanging fruit. If you, we all have to eat every day, but if we eat right and we avoid uh, processed meats, carbohydrates, we will protect ourselves. And that's something not only will take care of your asthma, it will take care of your other medical problem, whether it's a blood pressure, diabetes, and cholesterol. They are taken care. Asthma is not a benign disease. You know, 1 in 13 in United States have asthma, and it's about 20, come estimate comes about 25 million people out of 300 we are in United States have asthma. Worldwide, we have about 250 million people who are suffering from asthma. So this disease adds a lot of pain and suffering, loss of productivity. So it's not something which you could get by easily. We have kind of did a research from our patients, and I'm going to add some questions, which the most common questions which we had. People have asked us, and I'm going to present them to you so that I have taken care of most of them, but let's do that part. The first is the question here is, what are the early warning signs of asthma? I want to take up this question into two parts. One is, what are the early signs or symptoms? Usually, if you have a persistent cough, unexplained short of breath, or unexplained tiredness, look into this one is. But the early warning signs are, like, say, for example, you have established diagnosis of asthma, and you have, what are the things you could look for? Fever, increased sputum production, and you're getting tired and wheezing. And if you have peak flows which are going down, and if you have pulse ox and your saturation, remember I mentioned, if your saturation goes down, you should pay attention to it. And a lot of other symptoms like chest tightness, all those things, you should play. These warning signs technically are telling you your symptoms have gotten to the point they are getting worse, that you could go into respiratory failure. Those are, you're getting tired, your saturation start dropping, and you are having sweat, tightness in the chest, and you cannot hold conversation. Those are the good signs. Those are the signs which will lead to show you the treatment. Then next question, which we have come across over and over: how can I treat my asthma naturally with food? There are two principles: avoid inflammation causing foods and take anti inflammatory foods. Inflammation causing foods are simple carbohydrate, processed fats, trans fats, and processed meats. Cakes, cookies, pasta, bread in excessive amount, and especially the processed one with simple sugar like soda, sweet tea, juice, milk, all of them are pro-inflammatory and they will help. The foods which you should incorporate again is complex carbohydrates, unprocessed meat, omega-3 fatty acids, which are available in salmon and walnuts and flax seeds. And then food which is good source of vitamin D. There was a study they found that our people who have run low vitamin D, they have more frequency of frequent attacks. So make sure your doctor check your vitamin D, and you should start vitamin D supplement if you have asthma. And then best way to get asthma is get outside. Next is magnesium was also linked to some frequent flare-ups. If you have asthma, make sure you keep up with that or take the medications. Then the spices and the condiments like garlic, ginger, turmeric, they all have been shown to be very helpful. So, and beta carotenes, which is in carrots and all those things, all these things which are foods which are rich in vitamins, minerals, omega-3 fatty acids, they all will help you a lot. So rather than you worrying about specific diet for asthma, I would say you should take these medication these foods and put it as a natural part of your daily eating regime. That way you are taken care of for this part. Then other non pharmaceutical or treatment or this are breathing exercises, meditation, avoiding triggers. All these things with yoga, they all have been shown to be very helpful. Exercise and asthma. That question comes down very frequently in our practice. If you are going to be living, if you live in an area where your weather changes significantly, either you are exposed to a lot of heat or cold, that acts as a trigger. And in those areas, you need to prime your lungs with medication so that when you go and exercise and compete, you don't become short of breath. So this is, it used to be use your inhalers. You need that still holds good because they relieve the muscle spasm quickly and work this thing is. But if you are on a regular known diagnosis of asthma and it's mild, moderate, or severe, you should be on combination therapy, inhaled corticosteroid, and longer acting beta 2 agonists like Symbicort and Advair. You should use those. These and make sure you're vaccinated and rest of the part which we have talked about. Then there is a, now we call a step ladder treatment for the asthma. The core is avoid your triggers, consume anti-inflammatory foods, breathing exercises, and make sure you maintain your weather, the indoor temperatures closely, and then don't expose yourself to harsh weather quickly. And then the stress management that has been very, very effective. So this next slide presents the different things which you could do, which we have talked about, all the stimulus and triggers which you have. And then what are the things you could do? Don't go outside quickly, get vaccinated, all those things. The same themes will appear over and over. Next topic which I want to take up is what are the uh, things you should be regarding occupational asthma. See, in occupational asthma, what happens is you are home, you have no medical problem, you're not short of breath, you don't have tightness, you're not coughing. As soon as you go to do your work and suddenly you become short of breath, you have all these classic symptoms of asthma. You come back home, you have these symptoms. Then over weekends, you are doing good, and then you go back Monday, you have the symptom. So, two things can happen. Either in your working environment, there are some allergens which you may be dealing with, or there might be some irritants. Most of the time, farmers, people who work in metal industries, chemical industries, and they get exposed to these chemicals or allergens or pollutants which help you, which give you asthma problems or asthma related problems. How do you diagnose it? The best way to diagnose is your spirometry and the peak flows. Easiest thing is buy a peak flow meter. You could get it from pharmacy. Learn from your doctor's office how to do your peak flow. You do it at home, then you go and do it at work, and you will see the changes if the work triggers are contributing to that. Typically, if there is a change in your numbers more than 20% when you are exposed to uh, this thing, that will be coming to that you have occupational asthma. Treatment usually it change your job if you could afford it. If you can't, have them change you to a different place to work. Use protective gear, take medications, inform your HR. All these measures you should do that part. And usually the employers are very sensitive to your needs. They will work with you, and you will be able to come get some relief. My goal so far has been to kind of make you understand about asthma, that asthma is a two component, the inflammation in the inner lining, spasm in this in the muscles, and then the change in the treatment rather than using only bronchodilators or the medication to open up your bronchioles. Now they recommend taking anti-inflammatory medication or inhaled steroids as a first line. We went over stepwise treatment. We talked about the severity. We talked about taking the how to properly take the medications and what are the different medications available and concept of COPD, occupational asthma. I hope this short live session was helpful. Please submit your questions, write your comments, and if you could write in comment what are the other topic you want me to present, I'll be more than happy to do that part. Like, share, and subscribe to our channel Kundlas MD, and I will see you in next live session. Thank you very much.